Good afternoon, wonderful listeners. This is still Agadako New Life Clinic and also with the Herbal Shop. It's your health crusader, Agatha Akutubekwe. Throughout this month, we will be dealing with health education using natural foods and medicinal herbs. You can locate Agadako Herbal Shop at New Ashoman Estate, Obahima Bus Stop. We are between the community hospital and Melcom. Our lines are 0543 956165 and also 059 560 9510. You can also contact us on 0246 690 590. Today we are dealing with bronchitis. Bronchitis. Somebody will ask, what is bronchitis? Or the word bronchitis, what does it refer to? So today we are going to learn something about it. In short, I will say that bronchitis refers to an inflammation of the bronchi or air passage of the lung. So we are going to talk about the lung because bronchitis deals with the lung. It is a breathing disorder affecting the expiratory function. In fact, in most cases, some infection also occurs in the nose and throat. Bronchitis may be acute or chronic. That is mostly seen. Bronchitis is also an infection by a virus or bacteria that affect the mucous membrane lining of the bronchial tubes, causing a large amount of mucus to form, which is called phlegms. It may start as a cold or as influenza and then, because of inadequate treatment, extend down the air passage into the lungs. So we see how bronchitis works. And as I said, we have acute and chronic bronchitis. We will see what acute bronchitis is. That is bronchitis, the acute one, and then bronchitis, the chronic one. We are going to look at the differences. And then I will know the causes and then also the symptoms and then the treatment. Then we talk about the diet. So we'll look at acute bronchitis, the causes of acute bronchitis. The causes of acute bronchitis are these, like changeable weather, a catching cold, exposure, wet feet, chilling, when not sufficiently clothed, insufficient ventilation in the house. And then bronchitis will be uncommon if people ate the right food, kept their system free from mucus and poisonous waste material, and dressed properly. You know, stomach trouble and constipation are frequently associated with this bronchitis. That is why our diet should not be anything. We have to be selective. We have to be taking live foods that have life in them and not dead foods. Bronchitis, as we are talking about today, is a problem with the lungs. Let's look at some of the symptoms of acute bronchitis. You have chills, fever, tightness and stiffness in the chest, difficulty in breathing. Sometimes there is a severe cough and the attack comes on like crop. You'll be having pains in your chest. Some people don't experience pains, but they find it very, very, very difficult to breathe. In most cases, it is the larger bronchial tubes that are affected. The cough is also worse when the patient lies down and there is usually a bad coughing spell the first thing on waking in the morning. You see, at first, there may be but little mucus, but after several days, it increases and turns to yellow pus, sometimes becoming frothy. Children sometimes have convulsions and become unconscious. So that is how bronchial infections affect people and also children. For lung diseases or for bronchitis, as we are talking about, please, we should be careful how we expose our body and then ventilations. We have to be very, very, very much particular about it. And then, as I said, we have the chronic bronchitis too. So we'll look at the causes of these chronic ones. Acute bronchitis may become chronic if it is not properly treated and relieved. When someone catches cold or when a cold is allowed to continue, the infection may extend down into the lungs and become chronic. Occasionally, if it is not cured, it may encourage the development of tuberculosis or some other serious lung disease. Some forms of stomach trouble may be a cause of bronchitis and even pneumonia. This is particularly true of those persons who bring up acid and other stomach content into their mouth while asleep and then aspire, it into their lungs. Bronchial infections can be treated. So we shouldn't sit down for bronchitis to develop into chronic ones so that it will be difficult for you breathing. It will be difficult for you for heart seizure. It will be difficult for your kid to have convulsions on it. Please, we have to be very much particular about bronchial infections or bronchitis. One of the major causes of chronic bronchitis is cigarette smoking. I will say not even cigarette alone. Smoking itself, it's one of the major causes of bronchitis. Air pollution of mucus and phlegms, shortness of breath and wheezing. The symptoms may become very severe and then disabling. So we have to be very, very, very much particular about our lungs. Other symptoms consist of chills and fever, tightness and stiffness in the chest. As I said earlier, we will also look at the symptoms. What would you see or how would you experience for you to know that you have a bronchial infection? We will look at some of the symptoms. In most cases of bronchitis, the larynx, the trachea, and tissues of bronchial tubes are acutely inflamed. We see the swelling due to irritation. Large quantities of mucus are secreted and poured into the windpipe to protect the inflamed mucous membranes. There is also usually some fever, difficulty in breathing, as well as deep chest cough. Other symptoms are hoarseness, pain in the chest, lack of energy, and depression. The deep breathing continues, so the inflammation subsides and mucus is relieved. You have to be breathing very, very hard. Immediately you want to breathe normally, you wouldn't be able to. And if you are not careful, you even faint. So that is one of the symptoms of bronchitis. Apart from that, chronic cases, besides excessive production of bronchial mucus, there is infection and then lung destruction, which is very, very bad and affects a lot of people. We will look at some of the treatments of acute bronchitis and then chronic bronchitis in general. If you are suffering from bronchitis and there is no ventilation in your bedroom, you are in trouble because you are going to sleep in the room throughout the night. So it is a big challenge. We should always have a wide place to rest where there will be free flow of air so that it doesn't worry our lungs. If the person afflicted with this disease is a smoker, the most important thing to do is stop smoking. And if at all possible, stay out of smoke-filled rooms. Anywhere you can find smoke, you have to get out of that place. And then you can also take equal part of some herbs. And these herbs are very, very good for people who have bronchitis. It can be chronic or acute. You can take wild cherry, mullein, codfoot, yarrow, and then buckthorn. You can mix equal quantities of these herbs together using 1 teaspoon to a cup of boiled water. You let it sit for 10 to 15 minutes, and then you strain it. You take 1 cup full 4 times a day. Please, this herb that I have mentioned, you take equal quantity of the herbs. That is wild cherry, mullein, codfoot, yarrow, and then buckthorn. You take equal quantity of these herbs, and then you take a teaspoon per 1 glass of boiled water. You let it stay for between 15 to 20 minutes. Then you strain it. You take 1 cup full 4 times a day. It may be taken more often in smaller doses if preferred, but you should take 1 cup full 4 times daily. It will help you so much. And then all acid-forming foods must be eliminated from the diet. You need not drink whilst eating. You'll be drinking meals or liquid foods together. You can take your water 30 minutes before you eat, and then after 30 minutes, if you have finished eating, you can take water later, but not with the food at the same time. So do not drink with your meals, as taking with meals causes fermentation, acid, and gas. So that is how it goes. And then you must eat a lot of alkaline foods. You must eat a lot of alkaline foods, fruit juices of all kinds, especially pineapple, lemon, orange, grapefruits are also helpful if you want to loosen and then cut the phlegms to the barest minimum. It will help you so much. Everyone should have on hand the antispasmodic tincture and cough medicine made according to formulas that I have taught you, so that it will help you throughout the day. You'll be taking herbal teas throughout the day just to let you have painless chests, and then your depression and the lack of energy will all leave you. You will see that you'll be getting better and better and better. In acute cases of bronchitis, the patient should fast on orange juice and water till the symptoms subside. The procedure is to take the juice of an orange in a glass of warm water every 2 hours from 8 a.m. to 8 p.m. You see, during this period, the bowels should be cleansed daily with warm water using enema. So orange juice will be good for you. If you have any problem with bronchitis, orange juice from 8 a.m. to 8 p.m., you have to be taking this juice. After the first juice, the patient should adopt in all fruit diet for 2 or 3 days. We have different varieties of fruits. The one that will be best for you, just pick them and then you hang on them, you eat them. That is fruit juice fast for 3 days. In cases of chronic bronchitis, the patient may adopt an all-fruit diet for 5 to 7 days in the beginning of the treatment. So you see that fruits are very, very, very important in the treatment of bronchitis, especially orange juice. We should also have in mind other fruit juices like apples, pear, grapes, grapefruits, pineapples, peaches, and melons. Bananas and dried or stewed or tinned fruit should not be taken. Please, it doesn't help bronchial infections. So you have to abstain from bananas and dried or stewed or tinned fruits. You have to abstain from them. For drinks, unsweetened lemon water or cold or hot plain water may be taken after the all fruits diet. And the patient should follow a well-balanced diet based on groups. The 3 groups, basic fruits or basic foods, namely seeds and nuts, grains, vegetables, and fruits are all good. And I'll give examples of these seeds and nuts. We have the almond nuts, we have sesame seeds, we have chia seeds, we have sunflower seeds, and we have flaxseed. All those seeds are very, very helpful. They are very, very good. And when dealing with bronchitis, the patient should also avoid meat, tea, coffee, condiments, pickles, refined and processed food, soft drinks, candies, ice cream, and products made from sugar and white flour. These are the foods that if you have bronchitis, you have to abstain from. When I began earlier, I said you must lean on living foods, foods that have life in them. You must abstain from dead foods. And when we are talking of dead foods, these are examples of dead foods. I will repeat them again. These are examples of dead foods, and it will not help you. It will not help you treat bronchitis, whether acute or chronic. And these dead foods include meat, refined white sugar, tea, coffee, condiments, pickles, refined and processed foods, soft drinks, candies, ice cream, and products from sugar and white flour products. I know people like white flour. If you are treating bronchitis, these are some of the dead foods that you must abstain from. Certain vegetable juices have been found valuable in the treatment of bronchitis. The combined juice of carrot and spinach is especially beneficial. And then when you look at the formula proportions considered helpful in this combination are carrots maybe 10 ounces and spinach like 6 ounces to prepare maybe 16 ounces of 1 pint of juice. It will help you. So carrots and spinach are very, very good, helpful in the treatment of bronchitis. And then we have a hot Epsom salt bath every night of every other night will be highly beneficial during the acute stages of the attack. The patient should remain immersed in the bath for about 20 minutes. In case of chronic bronchitis, this bath may be taken twice a week. Hot towels wrung out over the upper chest are also helpful. Receive fresh and applied over the upper chest are also helpful. Fresh air and outdoor exercises are also essential to the treatment of bronchitis, and the patient should take a long walk every day. So in the treatment of bronchitis, exercises count. Exercises count. Don't be indoors. Walk and walk and walk till you have enough air in your lungs. So that is it. So exercise is very, very important. And then upon arising, a glass of lukewarm water mixed with half freshly squeezed lime or lemon and a teaspoon of honey will do. So when you wake up in the morning, you just warm 1 glass of water, you take half lemon, you slice it neatly with the back or not only the juice in it, including the seed in it. Then you pour water on it for some time, then you sip. This will help you so much. And then your breakfast should be fresh fruits, as we have said. I know we have mentioned a lot of fruit and then vegetable that we have to hang on them. If you don't hang on them, then you see that you'll be worrying your lungs. So, and then in the mid-afternoon, you can also have a glass of fresh fruit or vegetable as we have. It's your dinner. A bowl of fresh green vegetable salad with lime juice dressing, sprouted seeds, and a homemade any homemade green or any leafy vegetable soup or stew will help. Before retiring, date is also good. Date is also good. And then you have to avoid flesh foods. Diet should include lots of garlic, green vegetables, and then manganese-rich foods such as pear, beans, and nuts. We have to take note of these ones that I am saying now. If you want to treat your bronchitis so that it will leave you forever, you have to wet your chest packs daily for 1 hour on empty stomach. You must also use a hot Epsom salt bath twice a week in the night. And then there should be brisk walks and deep breathing exercise every day. If you can do that, then you are okay to go. Viewers, listeners, I thank you so much for listening to me. Today we have learned something about bronchitis. What bronchitis means, the acute and chronic bronchitis. If you have bronchitis, what you have to do, the foods you have to do, the exercises you have to do for prevention and treatment. Agadako Herbal Shop is located at New Ashoreman Estate, Obahima Bus Stop. We are between the community hospital and Melcom. Our numbers are 0543 956165 and also 054 0595 609 510, and then also 024 6690 590. Agadako Herbal Shop and Agadako Clinic. We do laboratory services. We do consultation services. In the herbal shop, you can also have your pure honey, medicinal clay, your activate charcoal, your medicinal palm oil. We have alkaline water and then health bread. We are so much grateful to you. It is your sister, Agatha Akoto Bequin, your health crusader, talking to you.